will be dropped if there is a universal health care plan. And I guarantee you that Obama will encourage employers to drop you, because the more people in the program, the lower the cost is, so he says. But the problem is, the more people on the program, the higher the cost. But here's what's going to happen. And I'm reaching out to you, Obama supporters, with this one, because I don't think you've had this explained to you yet in a proper form or fashion. You are going to put your taxpayer dollars into a big vat managed by bureaucrats. You are not going to have a choice in this matter. You are going to be annexed into the program, much like you were annexed into Social Security. You've never had a choice. If you have a legitimate job with a legitimate salary that you pay taxes on, you are part of the Social Security plan, whether you want to be or not. End of story. You're going to put your money into the universal health care plan. Then you're going to have to go to the government to ask for it back when you need it. Understand this, you will also be getting in line aside and behind other people for the same money, even though they're not the ones that contributed it. You are not going to see a direct return on your investment. You are not putting money into the hands of the government for your own purposes when you need it. Everybody is going to be qualified, but only a few will actually pay. We will not all contribute equally. When you have a system or a dynamic where a group of people put in a progressive amount of money based on their income and do not draw an exact value out versus people who contribute absolutely nothing and get something in return, that is socialism. That is how socialism works. Everybody puts their money into universal health care, then the government distributes the wealth based on need. Now, unless the government is planning on taxing you at 100%, they're going to have to ration these dollars. Even if they have $50 billion, even if what they have sounds like an unlimited pool of capital to operate universal health care, it's not unlimited. It will be limited, although large. So that means you may work for 20 to 30 years of your life, putting your money in without any choice into this universal health care system. And you may reach an age where you unfortunately get cancer. And if there's a block of, let's say, $100,000 budgeted for a typical cancer procedure, and there is 10 blocks of $100,000 set aside for a certain type of cancer, because it has to be rationed, that's the way it's going to work, and there's 12 people in line for one of those 10 blocks, if it comes down to you, a retired American who's contributed to the system for 30 years, and a 21-year-old recent immigrant, who do you think is going to get the treatment? The bureaucrat will see that you are at the end of your life and will no longer be productive to the system. Therefore, the system will best benefit by treating the 21-year-old recent immigrant who will live the next 40 years or 50 years or whatever, if cured. You will not get your money back from universal health care. You will not get any greater consideration for your contribution. In the real world, in the private sector, in your life, would you ever volunteer yourself to go to work every day, receive an income, put money into a system, and then have to get online and wait for that money to come back and have to ask the government for it? No, you wouldn't. You would not put your money into a fund or a stock or a company or anything else if you thought that you'd put your money into a big bucket and then it would be redistributed based on need, not contribution. The only way that happens is when the government does it. When the government says to you, you will go to work, you will achieve, you will get an income, we will take it from you, and then we are going to give it to somebody else in the form of health care. That is socialism. If you believe that to be right, then have the guts and the spine and the intestinal fortitude to call it what it is. It is socialism. It is socialized health care, where the person who contributes the most gets the least consideration. The people who contribute the most to the universal health care system will get no more consideration than someone who contributes nothing. By virtue of your contribution and someone else's lack of a contribution, you being treated equally, that is socialism. They call it equality. They call it morality. They call it humanity. They call it your obligation. The federal government's not empowered to create an obligation for you no matter what the reason. The federal government does not have the right to look a taxpayer in the face and say, you owe that person health care, whether it's a moral obligation or not. That is not the government's job. 1-866-95-PATRIOT, 1-866-95-PATRIOT. Here's another thing you ought to know about universal health care. You will be paying for the behavior of others. If you are a monogamous heterosexual in a marriage, a faithful marriage, you will be contributing to the system for promiscuous homosexuals when they get HIV and AIDS. And that's not scaremongering. You will see no benefit financially by staying healthy. As a matter of fact, you'll be bled even more. You'll be bled by the system. It is now your obligation to open your veins and let the vampires of government suck you dry. It is your job to provide blood for others, literally. That's what the government's telling you. Here we have a group of people who are engaging in a behavior that they assert is their right. It is their right. It is this man's right to put his manhood where that man evacuates his bowels, and you can do nothing about it. And if that man transmits HIV and AIDS to that man, that's two people now who have HIV and AIDS. You, who had no participation in their activities and no right to deny them the right to behave that way, now have to pay the bill, and that's what Democrats call fair. And the way they call it fair is by showing you images of people who are sick, people who are dying, people who are unhealthy, and they say, it's you. It's not your fault, but it is your burden. And that's what universal health care is, and that's where we're heading. And if they could do it with health care, if they could assess Maslow's hierarchy of needs, wants equals needs, needs equals entitlements, then if a need exists, then the government will assert the right to provide for all, based on you. Next it'll be food, then it'll be shelter, then it'll be clothing. And if they have their way with the environmentalists, we'll all be riding to work on our government bikes in our government pajamas, living in government block housing. If they could make this economy squeeze every single person into mediocrity, they would. Lop off the top and raise up the bottom. I'm right. 100%. We're right, they're wrong. End of story. John Murtaugh.